So let us begin with the second psychiatric disorder that we've been assigned, that is the major depressive disorder, or the depression, or that is commonly called as depression. So depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, and also called as major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day to day activities, and sometimes you may also feel that life isn't worth living. So, this depression is in today's world very commonly found in the adolescents or the teenagers, which is because this is a phase when most of the people are trying to figure out what the changes around them. Because of the hormonal imbalance in them and a lot of new stuff in the body, they're not able to figure out what's happening. Yeah. So let's get carry on with the symptoms. The symptoms that are found in a depressed person would be feeling of sadness, tearfulness, emptiness, or hopelessness. The second one is angry outburst, irritability, or frustration, even over small matters. Loss of interest or pleasure in most or normal activities such as sex, hobbies, or sports. Sleep disturbances, such as including insomnia or sleeping too much. Tiredness and lack of energy, so even small tasks take extra effort. Reduced appetite and weight loss or increased cravings for food and weight gain. Anxiety, agitation, and restlessness. Slowed thinking, speaking, or slowed body movements. So let us talk about depression symptoms in children and teens. The common signs and symptoms of depression in children and teenagers are similar to those of adults, but there can be some differences. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, and refusing to go to school or being underweight. In teens, the symptoms may include sadness, irritability, feeling negative, worthless, anger, poor performance or poor attendance at school, feeling misunderstood, and gradually the inclination towards the substance abuse of drugs and alcohol, eating too much of junk food, sleeping too much. So, when is the right time to consult a doctor? If you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can, because depression is a very dangerous disease that is generally thought to be not that dangerous, but once the person gets into depression, then there is there's no way out of it if the person is not saved or rescued very soon. When to get an emergency help? If you think you may hurt yourself or attempt suicide, then you need to call and make an appointment as soon as possible. The causes that lead to depression are, uh, the first one would be biological differences, meaning people with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but eventually help pinpoint causes. The brain chemistry. Neurotransmitters are naturally occurring brain chemicals likely play a role in depression. Recent research indicates that changes in the function and effects of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. So it's all the brain chemistry in here about all the hormones that play and its pathway. Um, the third one is hormones. Changes in body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks and months after delivery, and from thyroid problems, menopause, or a number of other conditions. The last one would be inherited traits, so meaning genetic. Depression is more common in people whose blood relatives also have this condition. The risk factors that are involved in depression. Depression often begins in the teens or the adult in the early adulthood, or it can happen at any age. There's no specific age for depression. But what is commonly found is in this the above mentioned ages. Factors that seem to increase the risk of developing or triggering depression include certain personality traits, traumatic or stressful events, blood relatives, meaning genetic, being lesbian, gay or bisexual or transgender, or having variations in the development of genital organs that aren't clearly male or female in an unsupportive situation. So, what is important in depression is the love and the care of the loved ones. In this situation, the parents especially need to be very strong and supportive with their children. Also, they need to keep thorough. Uh, they also need to keep a check on their children, have regular talks with them, and consult a psychiatrist, because there is no shame in getting yourself treated for a psychiatric disease. So, yeah, thank you.